Module 4, looking at respiratory medication. We're going to take a look at some lower respiratory medication that treat lower respiratory condition, things like asthma, emphysema, COPD, pneumonias. So we're going to look at bronchodilators, anticholinergics, and the methylxanthines. So bronchodilator is a beta agonist management for asthma and different pulmonary disease. Typically, this is a first line of drug for acute bronchoconstriction, and they cause bronchodilation by relaxing the smooth muscles. There are long-term and short-term beta agonists. They have no anti-inflammatory effect. So if there's inflammation, some sort of a corticosteroid needs to be used, whether it's systemic, whether it's intranasal, or an inhaled corticosteroid. So there's a LABA and a SABA, a long-term and a short-term bronchodilator. And one of the teachings is make sure not to mix them. Patients can mix their short-term and long-term inhaler, and especially if they're having like an acute asthma attack and they're using their long-term, that's just going to tip them over the edge and probably land them into a hospital. Some of the adverse effects of a bronchodilator is tachycardia, dizziness, tremors, hypokalemia, so low potassium levels, which can cause dysrhythmia. So somebody does come into the ED after a couple of days of albuterol use, and they are complaining of some sort of palpitations, or they have an abnormal EKG. Checking for potassium level is important. Bronchodilators can also have a paradoxical effect. There's that word again, opposite and of what you want, and they actually will cause bronchospasms, not relaxation. Hyperglycemia could be seen, especially for type 1 diabetics or type 2 diabetics. Urinary retention. Anticholinergic drugs block the parasympathetic nervous system, causing bronchodilation. So short-acting and long-acting will cause the bronchodilation. One of the common long-acting one is what you'll see is you will see combination of drugs, a short and a long-acting combination in one inhaler, so that way the patients can use one inhaler, and that will cover both the long-term and short-term. Atrovent is a very common one. The generic name for that is ipratropium. It is a short-acting anticholinergic medication. It is being one of the most popular. With that one, you want to let your patients know to rinse their mouth after they use the inhaler to avoid any fungal infection. And also for them, if somebody has a soy or a peanut allergy, they are not to use Atrovent, ipratropium. Some other side effects that you might see with using these medications are headaches, dry mouth, cough, GI upset, anxiety. And again, combination drugs are used for better efficacy. Also, we're going to look at methylxanthines. It's kind of an old treatment, but for asthma, it is more chemically related to caffeine, and it has a narrow therapeutic range. So when a drug has a narrow therapeutic range, there's a potential for toxicity. So those are not used as often. So one of the popular ones is Theophylline, a methylxanthine that you might see. So this one you want to watch out for toxicity. And if there, you might see that, so how you would recognize this toxicity of it is a dysrhythmia, hypotension, seizures. They might seem like they're having like an angina attack. Another education point for patients taking these medications is they should avoid alcohol, caffeine, and any MAOIs. One more thing to kind of refresh your mind on is when talking about bronchodilators and using inhalers, whether they're using an inhaler by itself or with a spacer, go back and review the proper techniques of administering a medication. So using a meter dose inhaler, how inserting into your mouth, removing the cap, holding inhaler upright, shaking it for 3 to 5 seconds, tilting your head back, positioning the inhaler 1 to 2 inches away from the open mouth and attaching the spacer to it, breathing slowly and deeply for 3 to 5 seconds, holding your breath for 8 to 10 seconds, making sure the medication moves down the airway, and then waiting 1 to 3 minutes in between puffs. And then you want to rinse your mouth after using the inhaler, using soap to wash out all the equipment and then air dry it. So just to review that, you might see some questions that will ask you about using an inhaler.